Okay, in the next videos, what we're going to do is describe the muscles in groups, and we're going to group them according by their action and trying to group them according to their innervation. Now, the individual groups of, the individual muscles are going to be studied on the lab. The origins, insertions, actions, and innervations of every muscle. In here again is just in bulk, okay, in groups. So let's describe, just to put some logic into this. Let's describe the muscles that are crossing the joint, the shoulder joint, the glenohumeral joint. Remember, we need the muscle to cross the joint, otherwise it won't make or produce any movement. So if the muscle, and we repeat again the same slide, as you can see, we have here the scapula and the clavicle forming the pectoral girdle, and the humerus, the arm, the bone of the arm. So if a muscle crosses the joint anteriorly, let's say from clavicle to humerus, for example, it will what? It will flex the arm at the shoulder. If the muscle crosses the joint now posteriorly, the glenohumeral joint, now it will, when it contracts, it can extend or hyperextend the arm at the shoulder or at the glenohumeral cavity, glenohumeral joint. If the muscle crosses the joint laterally or superior to this joint, okay, when we shorten, it will abduct the arm. If the muscle crosses now the joint from the medial side of the humerus to the lateral side of the thoracic cage, okay, it can adduct the arm at the shoulder, okay. Lateral two more movements that can be performed, as you remember from joint on the glenohumeral joint, is medial, okay, medial and lateral rotation. And these movements are performed by the rotator cuff muscles that we will describe on the lab. Ready? Okay. Let's describe now the muscles that are crossing the elbow joint. So these muscles are going to cross the joint either anteriorly or posteriorly. If you remember, the elbow joint is a hinge joint. It's a uniaxial joint allowing only flexion and extension of the forearm at the elbow. So muscles that are crossing the joint anteriorly will flex the arm. See, like I'm placing again one strip. Well, it's red. One, let's get the rubber band to explain that part. Okay, if I place a rubber band, right, from here to here, and I shorten, I'm going to bring closer together. I'm going to reduce the angle between the forearm and the arm and produce flexion. If now I'm going to contract a muscle that crosses the joint posteriorly, the elbow joint, I'm going to extend the forearm at the elbow. I was going to tell you something. Well, so following this arrangement, we're going to describe in the lab the anterior muscles and the posterior compartment of muscles of the arm. But please keep in mind that these muscles are crossing the elbow joint, so they can move the forearm. Muscles crossing the shoulder joint move the arm. Muscles crossing the elbow joint move the forearm, and muscles crossing the wrist can move the hand and the fingers. Now, on the arm, see, this is a transverse section of the arm, and we can see in here, where is my pen? I don't find it. Here it is. Okay. And it's not working. Okay, cursor. Here I can see the cross section, the transverse section through the arm. It's like you cut my arm like that. So you can see right in the middle, this is the humerus, the transverse section of the humerus. All of this is anterior. The anterior muscles located in there. Here's the brachialis and biceps brachii. And posteriorly, behind the humerus, is the triceps brachii. Now, all of these posterior compartment of muscles, the action is extend the forearm at the elbow, and all the actions of the anterior compartment of the arm is to flex the forearm at the elbow. All of these muscles are innervated by the musculocutaneous nerve, which is in here. Remember, innervation is just, when I ask you about the innervation, you need to give me a nerve. The nerve that is stimulating these muscles to contract. On the posterior aspect of the posterior compartment of the arm is innervated by the radial nerve. Done. Now, and here we can see the movements. Flexion of the forearm at the elbow and extension of the forearm at the elbow. Okay, let's see the last slide for this video, and we're going to describe now the muscles that are crossing the wrist joint. Okay, so they're going to originate somewhere on the forearm or on, radius or ulna, or even on the humerus. And they're going to cross anteriorly, posteriorly, medially, or laterally the joint, the wrist joint. So if they cross, again, same example, let's put it like this. If I have a joint, a muscle, and you see it here, that crosses anteriorly from any place here in the forearm to the wrist, or it goes to the fingers, when I contract it or I pull it, I can flex the wrist or the fingers, or both. If I place it now, how can I do this? Okay, posteriorly, see, now it's in the posterior aspect of the forearm, and I contract it, I can, when I shorten, wait a minute, okay, when I shorten that, I can either extend or hyperextend the wrist or the fingers, okay? If I place, and I'm gonna put it in my fifth finger just because it's easy to put it, but if a muscle crosses the joint, the wrist joint medially, let's say from the ulna to one of the carpal bones, the medial carpal bones or the metacarpals, and I put it here, when I contract this muscle, I can produce, what is this? Adduction with two D's, or ulnar deviation. If now I put it on the lateral side and I pull it, I can produce, this is radial deviation or a bduction, abduction. That's how we explain the movements on the upper limb. Now, please keep in mind, I just described here, just for the sake to keep it simple, muscles crossing just one joint. But there are muscles that can span two joints, okay? So they can have, they can produce movements, for example, at the shoulder and at the elbow. Examples, biceps brachii. Biceps brachii originates on the scapula, crosses the glenohumeral joint, and attaches or inserts on the radius, which is on the forearm. So it crosses also the elbow joint. So it's going to have, it can flex the arm at the shoulder, but also can flex the forearm at the elbow. And here is where the uh, this muscle is more important. Is weak. Is a weak arm flexor. But don't worry, that's a theme of the lab. So see you in the next video. We are going to follow the same template to describe the muscles of the lower limbs. See you. Sorry, I forgot to mention something. On the forearm, we didn't describe this picture. In this picture again, we have the cross section of through the forearm, so we can see this is the radius laterally located, and this is the ulna. All the muscles anterior to these bones are the anterior compartment of the forearm, and they're subdivided. We'll study that on the lab. And behind or posterior here to those bones, we are going to find the posterior compartment of the forearm, muscle compartment of the forearm, and again they are divided or subdivided into superficial and deep. Superficial or closer to the skin, and the deep layer is closer to the bones. Innervation, again, all the posterior muscles, remember, they are extensors of the wrist or extensors of the fingers, and they are innervated by the radial nerve, just like the posterior compartment. So you can group, you don't have to memorize one by one the muscles. If, of course, you need to know them, but you're not going to say, okay, the triceps brachii, radial, the extensor carpi radialis, radius. Just put all the muscles in the posterior compartment of the arm and the posterior compartment of the forearm. All of them, no exception, are innervated by the radial nerve. All of them. All the muscles in the anterior compartment of the arm, we said they are innervated by the musculocutaneous. All the anterior muscles on the anterior compartment of the forearm, they're innervated, most of them, by the median nerve, is written in here, median nerve, except 1.5 muscle. They are innervated by the ulnar nerve. The rest we're going to cover on the lab. Now, see ya!